A pharmacy technician notices that a medication bottle has a torn label. The safest action is to A. Tape the label back on. B. Set the medication aside for pharmacist review. C. Guess the medication by tablet markings. D. Place the bottle back on the shelf. Answer B. Any damaged or unclear label must be reviewed by the pharmacist to prevent misfills and ensure patient safety. Which situation requires reporting through the FDA MedWatch system? A. Customer complaint about rude service. B. Pharmacy stock expiration report. C. Unexpected serious reaction to an FDA-approved drug. D. Delay in insurance authorization. Answer C. MedWatch collects reports of serious adverse drug events or product quality problems for safety surveillance. A technician finds two lookalike medications stored next to each other. What is the best corrective action? A. Move one medication to a separate bin. B. Leave them, the pharmacist will catch errors. C. Mix them to save space. D. Store both on the top shelf. Answer A. Lookalike/soundalike drugs must be physically separated to reduce the chance of dispensing errors. A patient receives a medication they are allergic to. Which step failed? A. Inventory control. B. Patient counseling. C. Allergy screening verification. D. Refrigeration monitoring. Answer C. Allergy checks are part of safety protocols and must be verified at every dispensing step. Proper procedure for handling hazardous medications includes A. Crushing tablets to make them easier to count. B. Wearing appropriate PPE. C. Using bare hands if tablets are coated. D. Opening all blister packs for airflow. Answer B. PPE protects staff from hazardous drug exposure as required by USP less than 800. Which of the following is a high alert medication? A. Ferrous sulfate. B. Metformin. C. Insulin. D. Loratadine. Answer C. Insulin is a high alert drug with a high risk of causing serious harm if misused. A technician accidentally breaks a multi-dose vial in the fridge. What should they do first? A. Wipe the spill with regular tissue. B. Document the loss in controlled substance log. C. Follow pharmacy spill procedures. D. Leave it and notify the next shift. Answer C. Proper spill cleanup prevents contamination and maintains safety. Which barcode element ensures correct product selection? A. NPI. B. DEA. C. NDC. D. CPT. Answer C. NDC identifies manufacturer, product, and package size, critical for accuracy. A technician notices an unusual increase in near-miss errors. The first step is to A. Ignore it. B. Report the trend to the pharmacist. C. Blame coworkers. D. Stop filling prescriptions. Answer B. Reporting trends supports continuous quality improvement. The 5 rights of medication safety include A. Right insurance. B. Right brand selection. C. Right patient, drug, dose, route, time. D. Right storage temperature. Answer C. These ensure accuracy in medication dispensing and administration. Which storage error creates the highest risk? A. Keeping labels nearby. B. Storing refrigerated drugs at room temperature. C. Face-forward shelving. D. Alphabetical organization. Answer B. Incorrect temperature destroys potency and endangers patients. A patient claims their tablet looks different than usual. The technician should A. Tell them it's fine and ignore. B. Double-check NDC and manufacturer. C. Tell them to check at home. D. Ask them to pay and leave. Answer B. Verifying NDC ensures the product is correct, especially with generic substitutions. A controlled medication returned from a patient must be A. Discarded in regular trash. B. Logged and destroyed per DA guidelines. C. Stored with OTC medications. D. Flushed down the toilet. Answer B. DA-compliant destruction prevents diversion and environmental harm. To reduce transcription errors, a technician should A. Enter prescriptions from memory. B. Skip unclear directions. C. Read back information for verification. D. Assume the dose is correct. Answer C. Reading back information verifies accuracy and prevents mistakes. Which is considered a root cause of medication errors? A. Slow internet. B. Poor lighting in work areas. C. Large parking lot. D. Brand substitution. Answer B. Poor lighting reduces visibility, increasing error risk. A medication requiring REMS means A. Drug has no side effects. B. Drug must be kept in freezer. C. Additional monitoring is required for safe use. D. Insurance will not cover it. Answer C. REMS programs ensure safe use of high-risk medications. A drug with a narrow therapeutic index requires A. Normal monitoring. B. Less attention. C. Extremely precise dosing. D. OTC substitution. Answer C. Small dose variations can cause toxicity or treatment failure. If a patient receives the wrong strength, the error type is A. Monitoring error. B. Preparation error. C. Dispensing error. D. Administration error. Answer C. Incorrect strength relates to dispensing accuracy. Refrigerator temperature should be checked. A. Once weekly. B. Twice daily. C. Once monthly. D. Only if power goes out. Answer B. Twice daily checks ensure stability of temperature-sensitive medications. To prevent cross-contamination when counting medication. A. Count all tablets with the same tray. B. Wipe the tray between medications. C. Leave residue from previous counting. D. Use gloves instead of cleaning. Answer B. Cleaning trays prevents residue transfer and contamination. If a technician sees a medication with particles in a vial, they should A. Shake the vial. B. Dispense it if needed. C. Quarantine the vial. D. Filter the medication manually. Answer C. Any contamination requires isolation for pharmacist evaluation. Which organization sets standards for compounding quality? A. CPT. B. USP. C. IRS. D. WHO. Answer B. USP establishes official compounding and quality standards. A technician must verify a child-resistant container is not used when A. Patient has arthritis and requests non-CRC. B. Medication is expensive. C. Bottle size is too large. D. It's a refrigerated drug. Answer A. Patients may request easy-open bottles if documented. A tall man lettering example to prevent LASA errors is A. Metoprolol, metoprolol. B. Hydralazine versus hydroxyzine. C. Aspirin versus Tylenol. D. Benadryl versus Sudafed. Answer B. Tallman lettering highlights key differences in lookalike drugs. The purpose of a beyond use date, BUD, is to A. Replace NDC. B. Indicate the product is unsafe after a certain time. C. Show manufacturer expiration. D. Replace the lot number. Answer B. BUD refers to safe use limits after compounding or opening. If a medication recall is Class 1, it means A. No risk to the public. B. Minor quality issue. C. Severe or fatal health risk possible. D. Only cosmetic defects. Answer C. Class 1 recalls involve the highest danger. Proper procedure for an interrupted prescription fill is to A. Leave everything scattered. B. Discard the label. C. Store all materials in a holding area. D. Start over from memory. Answer C. Holding areas prevent mix-ups when work is paused. A confined counting area helps prevent A. Expired medications. B. Spillage tracking. C. Distractions that lead to errors. D. Insurance denials. Answer C. Minimizing distractions improves accuracy. Controlled substances require A. Return to stock without documentation. B. Double-locked storage. C. Storage with candy to hide them. D. Open access for technicians. Answer B. Security reduces diversion risk. A sound-alike pair is A. Amoxicillin versus doxycycline. B. Clonidine versus clonazepam. C. Vitamin C versus zinc. D. Warfarin versus ibuprofen. Answer B. Clonidine/clonazepam are commonly confused due to name similarity. When compounding, the technician should first A. Guess the formula. B. Wash hands thoroughly. C. Choose the largest beaker. D. Ignore PPE guidelines. Answer B. Hand hygiene is the first offense against contamination. A patient receives expired medication. What error type occurred? A. Labeling error. B. Compliance error. C. Storage and safety error. D. Therapeutic duplication. Answer C. Failure to remove expired meds violates safety protocols. After filling a prescription, the technician should A. Call the prescriber automatically. B. Perform a final accuracy check before it reaches the pharmacist. C. Seal the bag and skip verification. D. Skip counting if the bottle is full. Answer B. Self-checking reduces technical errors before pharmacist verification. HIPAA protects A. Inventory counts. B. Staff break schedules. C. Patient health information. D. Supplier pricing. Answer C. HIPAA ensures confidentiality of patient data. Which is an example of a medication administration error? A. Wrong route. B. Wrong employer ID. C. Wrong insurance. D. Wrong store location. Answer A. Route mistakes are a type of administration error. The purpose of barcode medication administration, BCMA, is to A. Speed up checkout. B. Match medication to the correct patient. C. Track store inventory. D. Assign pharmacist schedules. Answer B. BCMA ensures correct patient medication matching. Which situation requires immediate pharmacist involvement? A. Broken safety cap. B. Incorrect dosage calculation. C. Out-of-stock OTC item. D. Printer malfunction. Answer B. Dose calculations directly affect patient safety. Technicians minimize dosing errors by A. Relying only on memory. B. Using standardized measuring devices. C. Guessing liquid volumes. D. Using kitchen spoons. Answer B. Proper measuring devices ensure precision. A patient returns a medication claiming the seal was broken. The pharmacy must A. Place it back on shelf. B. Throw it in regular trash. C. Quarantine it as unsellable. D. Give it to another patient. Answer C. Broken seal products are unsafe and must be removed from use. A technician preparing to reconstitute an antibiotic should first check A. Patient's insurance. B. Water temperature preference. C. Correct diluent and volume. D. Store manager's schedule. Answer C. Using the correct diluent ensures drug stability and potency.